Peace be to you. This is Omar Abdul Malik, physician assistant and health educator. This is a video answer to a question that I received from somebody about the COVID-19 virus, also known as the coronavirus. And they asked me, like, what am I doing about the COVID-19, the coronavirus? I will first say that I prefer to refer to it as the COVID-19 virus. That's the particular strain about which we are currently greatly worried. I'll give you a bit of background information about myself. I'm a physician assistant, and I do have a background in infectious disease. I started out in HIV medicine, did that for several years, and I've been a hospitalist physician assistant for the past few years. And I've got a doctorate in health education, so it's kind of, I see it as one of my duties to try to allay my community's concerns about certain outbreaks and health conditions through empowering people with the knowledge that comes from health education. So, what am I doing about COVID-19? I'm doing the same thing that I did with H1N1, the so-called swine flu, and Ebola, which was after that, I think, and before that, SARS, and before that, avian flu, and I think we had hantavirus, and of course, AIDS, or HIV back in when I first started working with patients back in 1990. And that's trying to use what I would call universal precautions, washing my hands, covering my mouth when I sneeze, not with my hand, but with the crook of my arm. Using, the hospital where I work has quite an ample supply of hand sanitizer. And, there's good old-fashioned soap and warm water. We do have patients that have upper respiratory infections. They're usually bacterial, and they're put on appropriate antibiotic regimens after having those sputum cultures and things like that. Some patients have to go on respiratory isolation or airborne precautions. That's where you go and you have a mask on. I'm going to do another video about the different types of mask, and do be aware that the masks don't necessarily protect the wearer as much as they protect the immediate community from your any bugs that you may be carrying. Yeah, I work in an urban environment. I'm here. Donald Trump and I are neighbors, actually. I'm here in Washington, D.C. And anytime you're in an urban setting, that's a relatively concentrated area, with a relatively high concentration of people, living and carrying on their activities of daily living right on top of each other. And we're exchanging air. Even if you're not in the person's immediate vicinity, you're still in the building with them or in the home with them, so you're sharing ventilation ducts. If you're taking public transportation, we're breathing each other's air. We're coughing, so you're breathing in people's expectorant. I was on the metro, and on the metro rail, you've got these handheld, these metal bars to keep from falling. Net on this short sleeve shirt, this lady sneezes on my arm, and like all of her expectorant got on my arm. I was like, oh God, so gross. And I tried to play it off because it was crowded. I wouldn't yell at her. I was like, oh, you got me. She's sorry. But we're out of hand sanitizer, so there's not much I can do other than try to wipe it all with tissue. Then I'm just smearing it all over my arm. So just know that one of the first barriers to any type of infection is your skin. I'll do another video on how viruses and other bugs like bacteria are spread. There's cutaneous spread, which is skin to skin, different fluids hematologists spread. I just butchered that. You know, blood. There's spread through sputum, just sneezing. Look up. There's an interesting picture of this. It's an old photograph of this man sneezing, and like all of his expectorant, so the saliva and mucus, just shoots for several yards. It's kind of gross, but it's interesting. But I'm, again, for me, universal precautions, since I do work with sick people, and they are in the risk category, so they're people that typically are over the age of, they're the elderly population in their late 60s and beyond. Many of them do have polymorbidities, specifically those that affect the respiratory tract. So whether it's COPD or congestive heart failure, different types of pneumonia. We just, I don't want to infect them with anything that I may have. So I'll wear a mask. Those of us that are in the healthcare profession, we're trying to stay away from the hospitals and the patients as much as reasonably possible. There's a physician, one of my physician assistant colleagues, I think it was in New York, is infected with the Covid-19. So he's made the news. I don't know the guy personally, but he's on isolation and he's being treated. With viruses, you can really only treat them symptomatically. People have asked me for antibiotics for viral infections. They don't work on helicopter. Antibiotics do not work on viruses. Those are two different organisms. But that's it. I hope that answers your question. We just need to keep level heads and not panic. When people panic, they're fearful, and oftentimes that fear turns into anger, and we turn on each other as individuals and communities and society, and that's not really conducive to trying to beat this thing, and we'll beat it. That's what we humans do. God willing, well, this will be old news in a year or two, and there'll be some other challenge for us with which to deal. But keep a level head. I keep a level head. Try to educate myself. Try to educate the public. Use the universal precautions. Hand washing, mask when appropriate, and that's it. Okay. And I'm not gonna get into the politics of the COVID-19. That's for other folks to do that. Anyway, I wish you all the best of success in your positive endeavors. Stay healthy, and if you have any other questions, I'll answer them to the best of my ability. Take care. Peace.